Good afternoon, dear students. Today I will be going to discuss about the ventricular system of cerebral hemisphere, and at the end I will discuss about the pathway of C.S.F circulation. So, let us see the viscera and the different ventricles and their arrangement. So, in this video you can see here in the viscera, this is hemisphere. Okay. So, this one is right cerebral hemisphere. You can see this is the superolateral surface, this part, this is the medial surface, and this is the inferior surface, and here you can see this is frontal pole, that is the anterior aspect. Okay. This one is frontal pole, this one is occipital pole. Okay. So, this is anterior aspect, this one is posterior aspect, and in the superolateral surface we can see this is temporal pole. Okay. So, this is one hemisphere, right cerebral hemisphere. You can see here, you can see this one is cerebellum. Okay. So, this is cerebral cortex, this is cerebellum. So, we are concentrating on the medial surface, so that we can see the ventricles properly. Actually, there are altogether 4 ventricles are there in the cerebral cortex. They are paired lateral ventricles, then 1/3 ventricle, and another is 4th ventricle. So, lateral ventricle are usually present within the forebrain vesicles. Okay. That is the cavity of the forebrain vesicles, and they are paired. So, you can see here this cavity, this is the lateral ventricle, and it is the lateral ventricle of the right side. Okay. So, same in the left side, if I see the left cerebral hemisphere, so again this is the lateral ventricle of left side. So, actually if we join this together, so just see here, this is lateral ventricle of right side and this one is lateral ventricle of left side. So, this lateral ventricle, you can see it is roughly C-shaped and it is lined by ependyma, ependymal tissue. It is lined by ependymal tissue, and lateral ventricle separated from each other. That means the right lateral ventricle separated from the left lateral ventricle by, that is known as septum pellucidum, and this lateral ventricle communicate with one another through interventricular foramen of Monro. Okay. So, let us see in the viscera the position of individual ventricles. So, you can see in the medial aspect there is a cavity like space here. So, this one is known as lateral ventricle. So, you can see this lateral ventricle, this cavity like space both in the left side and in the right side. So, we will get there are presence of 4 ventricles are there in the cerebral cortex, in the central nervous system. Among them lateral ventricles are paired, and there is another 3rd ventricle and there is another 4th ventricle. So, let us discuss about the lateral ventricle. So, you can see that it is roughly C-shaped. Okay. The shape is roughly just like the word, the letter C. So, it is present as the cavity of the forebrain vesicle during development. Now, this 2 lateral ventricle of left side and right side both communicate with the 3rd ventricle through interventricular foramen of Monro of the corresponding side. If we assemble both the hemisphere like this, so lateral ventricle for right side is present here, lateral ventricle for left side is present here. So, both side lateral ventricle are communicated with the third ventricle that is present in between the thalamus of the two sides. That means in this space, this is the space area for third ventricle. So, lateral ventricle of the both side communicate with the third ventricle through interventricular foramen of Monro. This is the position of third ventricle. Okay, this part is the position of third ventricle. This is thalamus. This one is thalamus. Okay, thalamus of the right side, same present in the thalamus of the left side. So, in between these two thalami, there is presence of third ventricle. So, lateral ventricle communicate with third ventricle through interventricular foramen of Monro. Again, if we see closely, you can see that this lateral ventricle communicated with third ventricle through interventricular foramen of Monro. This is the position of third ventricle. Okay. Then this third ventricle communicated through this aqueduct of Sylvius. This area is aqueduct of Sylvius. It is communicated with the fourth ventricle. This area, you can see this triangular area, this is known as fourth ventricle, that is present in between cerebellum and the brainstem. Okay, in the dorsal aspect of the brainstem and in front of the cerebellum. This cavity is known as fourth ventricle. This communication is known as aqueduct of Sylvius, that communicates the third ventricle with the fourth ventricle, and this one is the lateral ventricle, and here this is the position of foramen of interventricular foramen of Monro of individual side, corresponding side. So, through this interventricular foramen of Monro, lateral ventricle communicate with the third ventricle that is present in between the thalamus of corresponding side. Okay. Just see, if we approximate this cerebral hemisphere just like this. So, this is the position of thalamus. So, this is the position of third ventricle. Okay. So, these are the communications. So, lateral ventricle communicates with third ventricle, interventricular foramen of Monro of corresponding side. Again, third ventricle communicates with fourth ventricle through this aqueduct. Okay. This is the position of third ventricle. This is the position of third ventricle. Third ventricle communicates with fourth ventricle through this aqueduct of Sylvius, and this is fourth ventricle. Okay. Now, let us discuss about the detail of the individual ventricles. So, you can see here, this is lateral ventricle cavity. So, it has a body, that is central part of the lateral ventricle. Okay. And it has three horns or cornua, that is anterior horn. So, you can see here, this is the frontal pole. So, this is anterior horn. Okay. This one is anterior horn or anterior cornua. One posterior horn, you can see this is cerebellum, this is occipital pole. So, this one is posterior horn. Okay. Posterior horn, and another is inferior horn is there. So, you can see inferior horn is actually going within the temporal lobe. Okay. You cannot see here properly, just remember that there is one body of lateral ventricle, then one is anterior horn, another is that is going within the frontal lobe, another is posterior horn that is going within the occipital lobe, another is inferior horn that is going towards the temporal pole. Okay. Now, the extent of body is up to the interventricular foramen to the splenium of the corpus callosum. Now, what is corpus callosum? You can see here this structure, okay. This structure, this is known as corpus callosum, this whole structure, okay. So, this is a commissural type of fibers, it interconnects the both the hemisphere. So, corpus callosum, this is commissural fiber that interconnects both the hemisphere. Okay. So, what is splenium of corpus callosum? The corpus callosum has 4 parts are there. So, extent of body of the lateral ventricle from the interventricular foramen of Monro up to the splenium of corpus callosum. So, there are 4 parts of corpus callosum. So, you can see here this one is corpus callosum. So, what are the parts of corpus callosum from behind forwards? This is splenium, then body or trunk, then this one is genu, this bent is known as genu, and this is rostrum. So, extent of body of the lateral ventricle from this interventricular foramen of Monro up to the splenium, okay, this part, splenium, okay. So, this is the extent of the body of the lateral ventricle. Now, in the coronal section, this lateral ventricle is triangular in shape and it presents one roof, floor and medial wall, okay. In the coronal section, it is triangular in shape. Coronal means just like this. If we cut the cerebral hemisphere like this is the coronal section. So, we will get one roof, one floor and one medial wall. This lateral ventricle, there will be one roof, one floor and one medial wall. We will get roof is formed by the under surface of the corpus callosum, okay. Floor is formed by few structures from lateral to medial, that means from lateral aspect to medial aspect we will get body of caudate nucleus, okay. Let us see. This is the body of caudate nucleus, you can see here. This is the body of caudate nucleus in this viscera. Also, most laterally in the floor we will get the body of caudate nucleus, then this part, okay, this part, then we will get striaterminalis and thalamostriate vein. Just remember, it is theoretical, you cannot see here, and then we will get upper surface of the part of the thalamus. So, you can see this one is thalamus, okay. So, upper surface of part of the thalamus. So, floor will be formed by body of the caudate nucleus, then striaterminalis and thalamostriate vein, then upper part of the thalamus, okay, some part of the thalamus. Then more medially we will get the choroid plexus and upper surface of symmetrical half of body of the fornix, okay. So, these are the contents. The floor will be formed by these structures from lateral to medial side. Now, medial wall of the lateral ventricle is formed by the anterior part of the septum pellucidum, okay. That is the medial wall, that means this part towards the midline. Medial wall is formed by anterior part of the septum pellucidum, okay. And lateral ventricle, this is the roof and this is the floor of the lateral ventricle meet together and it come in direct contact with the body of the fornix. This part come in direct contact with the body of the fornix. Roof and floor meet together, posterior aspect, okay. Now, let us discuss about the horns. So, this is anterior horn. Anterior horn extends within the frontal lobe up to the genu of corpus callosum. So, this you can see here, this is going within the frontal lobe up to the genu of the corpus callosum. This is the genu of the corpus callosum, this bent. So, this is the position of anterior horn. In coronal section, we will get one roof, one floor, one anterior and one medial wall of the anterior horn of the lateral ventricle. So, roof is formed by the anterior part of the body of the corpus callosum. So, you can see this is the position of anterior horn. So, this upper part is roof. So, this is the body. Floor is formed by the upper surface of the rostrum of the corpus callosum in the medial part and by the bulging of the head of the caudate nucleus in the lateral part. So, now medial wall of the anterior horn, it is formed by septum pellucidum. Okay. Septum pellucidum covered this area. Okay. So, medial wall is formed by septum pellucidum. Let us discuss about the posterior horn. So, you can see here, this is the posterior horn that is going within the occipital lobe. Okay. This is posterior horn. So, extent of the posterior horn is backward and medially within the occipital lobe. This is the direction, backward and a bit medially. This is the posterior horn. Now, it has one roof and a lateral wall, and roof and lateral wall forms a continuous convex surface, and over this convex surface, this roof, and there is a lateral wall in that side, that is forms a continuous surface, and the fibers of the optic radiation pass along this surface separated by the tapetum of corpus callosum. Okay. This is the area where the fibers of the optic radiation pass over this surface and is separated by the tapetum of the corpus callosum. So, you can see here, this is the position of posterior horn, okay, where the forceps is going. Okay. This is the position of posterior horn. In the medial wall of the posterior horn, that means in that side we will get two elevations are there. You cannot see here in the medial wall as it we are seeing from the medial aspect. So, just remember there will be two elevations will be there in the medial wall. The above elevation, upper elevation, that is for the bulb known as bulb of the posterior horn and is formed by the fibers of the forceps major, that is another commissural fibers that joins the two hemisphere, that connects the two hemisphere. So, upper elevation and the medial wall of the posterior horn is formed by the bulging of the fibers of forceps major, and the lower elevation it is formed by the it is known as calcarevis, and that is formed by the inward projection of the anterior part of the calcareous sulcus. So, let us see what is calcareous sulcus. This one is known as calcareous sulcus, is present in the occipital lobe. So, this is calcareous sulcus. The inward projection forms a bulging in the medial wall of the posterior horn of lateral ventricle. So, that forms a calcar avis. So, upper elevation, that is known as bulb of the posterior horn due to the forceps major, and lower elevation due to the inward projection of anterior part of the calcareous sulcus. So, this is the anterior part of the calcareous sulcus. There is an inward projection here that forms a calcar avis in the medial wall of the posterior horn of lateral ventricle. Now, let us discuss about the inferior horn. Inferior horn goes backward and laterally. Okay. At first it goes backward and laterally this direction, and then around the pulvinar end of the thalamus. That means you can see here, this is thalamus, and pulvinar end means this posterior end of the thalamus. Around the pulvinar end of the thalamus, it goes downward and forward within the temporal lobe. Okay. First it goes backward and laterally, around the pulvinar end of the thalamus, it goes downward and forward in the temporal lobe, and it goes parallel with the superior temporal sulcus up to 2.5 centimeter behind temporal pole. If we can see from this side in the superlateral surface, so this one is superior temporal sulcus. So, this inferior horn goes parallel to this and it reaches just 2.5 centimeter behind this temporal pole. So, this one is temporal pole, this one is temporal pole, up to this it reaches like this inferior horn parallel to the superior temporal sulcus. Okay. So, inferior horn, the reduction of the inferior horn, first it goes backward and laterally, and around the pulvinar end of the, first goes backward and laterally, and around the pulvinar end of the thalamus it changes the direction, it goes forward and downward parallel to the superior temporal sulcus and goes up to within the temporal lobe 2.5 centimeter behind the temporal pole. Okay, this is the direction of inferior horn of lateral ventricle. Then it has one roof and floor. So, roof in the lateral part is formed by the tapetum of corpus callosum, and medial part it is formed by the tail of caudate nucleus, amygdaloid body and stria terminalis. So, roof is formed by the tapetum of corpus callosum, and in the lateral part, and in the medial part is formed by the tail of caudate nucleus, then amygdaloid body and stria terminalis. Okay. Floor from lateral to medial, it is formed by collateral eminence, hippocampus and choroid plexus. Okay. Now, let us discuss about the third ventricle. Okay. Third ventricle is an area that is present between the two thalamus, that is in the interthalamic space. It is again lined by ependyma, and it has one anterior wall, posterior wall, roof, floor and two lateral walls. So, if we imagine one space here, one square like space here. So, it has one roof, one floor, then one anterior wall, then one posterior wall and two lateral walls. So, this area where my fist is there, this is the position for third ventricle. So, anterior wall it is formed by, you can see here, it is formed by, so this is the position for anterior wall of the third ventricle. So, this area, this is the position for anterior wall. So, anterior wall is formed by from before backwards, that is lamina terminalis, anterior commissure and diverging columns of the fornix. So, you can see here, this is lamina terminalis, okay, this one, this is lamina terminalis, this is anterior commissure, okay, and you cannot now posterior wall of the third ventricle is formed by from above downwards suprapineal recess, okay, this part is suprapineal recess, then this is pineal body with pineal recess. You can see here, this is suprapineal recess, pineal body with pineal recess, and then commencement of aqueduct. This part is commencement of aqueduct of midbrain. Now, you can see here pineal recess, this part is pineal recess, is a triangular structure and extend into the stalk of the pineal body. This is pineal body, so this is stalk of the pineal body, and here the upper lamina of the recess is traversed by havenular commissure and lower lamina is traversed by posterior commissure. This is the position of posterior commissure, here is the position of havenular commissure. Now, roof of the third ventricle is formed by the ependyma, okay, it is lined by ependyma, and it is supplemented by body of the fornix, because this is the position of fornix just in the undersurface of the corpus callosum. Okay. So, it is roof is formed by the ependyma and supplemented by body of the fornix, and there is some parts of the choroid plexus are present here also, that projects into the ependymal roof. Okay. And in the floor, this is the floor, this is the position of the floor of the third ventricle. This, if we imagine one square box like space here, so this is the position of floor of the third ventricle. So, floor of the third ventricle slopes downward and forward. You can see here, this is the posterior aspect, this is the anterior aspect. So, this is the position of floor of the third ventricle, slopes downward and forward. So, we can get in the floor from before backwards, we will get optic chiasma. Okay. Let's see the structure a bit carefully. So, this is optic chiasma. Okay. You can see this is the optic chiasma, this part optic chiasma. Then we will get tuberous cneridium, we will get tuberous cneridium. Just 1 minute. This is optic chiasma, this part we will get tuberous cneridium. Okay. And we will get infundibulum and a pair of mammillary bodies. So, these are the mammillary bodies. Here there is infundibulum, this is optic chiasma. Okay. If you see from this side, it will be more clear. This is optic chiasma. Okay. Optic chiasma. So, we will get from before backwards these structures. Most anteriorly we will get optic chiasma. This is optic chiasma. Then we will get tuberous cneridium, then infundibulum, then pair of mammillary body, and here we will get posterior perforated substance here. So, this forming the floor of the third ventricle, and the floor is slopes downward and forward. You can see the direction, slopes downward and forward. So, regarding C.S.F circulation, if we see, this is one lateral view. So, C.S.F is mainly formed by the choroid plexus of the lateral ventricles. You can see here, this is the position of lateral ventricle. Okay. So, it is formed by the choroid plexus of the lateral ventricle, then it traverses through the interventricular foramen of Monro in the third ventricle, then it goes along the aqueduct, cerebral aqueduct of Sylvius in the fourth ventricle. This is fourth ventricle. Then from the fourth ventricle, it goes in the subarachnoid space through the foramen of Lasca and foramen of Magendie. If you see this picture here, these are the lateral ventricles. After formation of C.S.F, it comes in the third ventricle through foramen of interventricular foramen of Monro, then it goes in the third ventricle. From third ventricle, it goes through the cerebral aqueduct of Sylvius in the fourth ventricle. The fourth ventricle is rhomboid shaped structure space. So, we can see two aperture here in the lateral angle of the fourth ventricle, that is known as foramen of Lasca, and one median aperture we will see, that is known as foramen of Magendie. So, through this foramen from the fourth ventricle, C.S.F goes to the cerebellomedullary and cerebellopontine cistern, that is the subarachnoid space, and also C.S.F goes to the central canal, again it flows back, and finally through these foramens it goes in the subarachnoid space, and then up to this dural venous sinus, and it is absorbed by the arachnoid granulations, those are present just in the connection of dural venous sinus. So, these are the whole pathway of C.S.F. So, after formation from the lateral ventricle, from the choroidal plexus of lateral ventricle through interventricular foramen of Monro in the third ventricle, then from the third ventricle through aqueduct of Sylvius in the fourth ventricle, from the fourth ventricle it goes through the lateral aperture, that is the foramen of Luschka, and through the median aperture, that is the foramen of Pagendi in the subarachnoid space, that is cerebellomedullary cistern or cerebellopontine cistern, and again it goes along the spinal canal in the spinal cord, in the central canal of the spinal cord. This part again goes back and through these apertures go into the subarachnoid spaces, the cisterns, and then in the dural venous sinuses, where it is being absorbed through the arachnoid granulations. Okay, you can see here this arachnoid granulation. So, that is all for the ventricular system. Thank you. Regarding C.S.F. Circulation demonstration in this viscera, you can see that the choroid plexus is there in the roof of the lateral ventricles. So, from here the C.S.F. is being produced. After that it goes in the third ventricle. This is the position of third ventricle, goes through the interventricular foramen of Monro, then it goes through the aqueduct, cerebral aqueduct from third ventricle to fourth ventricle. Then in the lateral angle of this fourth ventricle there are foramen of Luschka, paired foramen of Luschka, and in the midline there is foramen of Magendie. Through these foramens or apertures, C.S.F. goes in the subarachnoid space, okay, and some part of it goes through the spinal canal downward up, and some part of the C.S.F. goes to the cerebellomedullary cistern or cerebellopontine cistern. Then it goes ultimately in the dural venous sinuses, and it is being absorbed in the arachnoid granulations, that is, those are present in contact with this dural venous sinuses. So, this is in short the pathway of C.S.F. circulation.